We're very pleased to be joining the World Health Organization in the effort to reduce the burden of cardiovascular disease, which is the number one death in almost all countries around the world now. In this particular discussion, we'll be focusing on reducing hypertension, which is one of the most important risk factors for cardiovascular disease. Specifically, we know that hypertension strongly increases the risk of stroke and heart attacks and is one of the major contributors to increase early mortality. So finding ways to prevent hypertension is really critical to reducing the overall well-being of a population. From many decades of research, we know what we need to do to prevent hypertension. The biggest challenge is how do we accomplish this? Specifically, we know that reduction in sodium intake will have an important contribution to reducing blood pressure and hypertension. We know that eating a balanced diet is very important. And specifically, that means plenty of fruits and vegetables because they contain high amounts of potassium, and that lowers hypertension. Also, keeping refined carbohydrates and sugar, especially sugar-sweetened beverages, low is very important as well. Of course, high alcohol consumption or binge drinking is a contributor to hypertension. Very importantly, body weight is one of the most important risk factors. In other words, being overweight or obese increases risk of hypertension very substantially. And related to today's topic, reduction of or increases in physical activity are important in reducing blood pressure and hypertension. The role of physical activity is important in several ways. It, of course, is one of the most important ways to avoid gaining weight and becoming overweight or obese, but regular physical activity has additional physiological benefits on blood pressure as well. So to start this detailed discussion going in, can you tell us about what we mean when we talk about physical activity?
We should clarify physical activity and describe it as being two types of physical activity. There's the regular physical activity, which is daily routine physical activity, such as walking or biking to work, walking to school, biking to school. The other is what's called discretionary physical activity. The downside to discretionary physical activity, such as going to the gym or playing tennis or swimming, is that that is set aside time in a day. And as all of us know, we can be vigilant about setting aside time to go to the gym, and then for whatever reason we find that we don't have the time. So we tend to focus on the benefits of regular walking and biking. But when we had the opportunity to do research with you on your lovely Nurses Health Study too, we looked at slow walking, brisk walking, and bicycling in association with weight control. And we found, surprisingly, that 50% of the nurses out of 18,414 nurses that we studied walk slowly. And slow walking, as you had found in earlier studies, was associated with not controlling weight. Brisk walking was associated with controlling weight, but only 39% of the nurses walked briskly. And also, if you were really overweight, you tended to be less willing to walk briskly because it hurt. It hurt your hips, it hurt your knees. So we then looked at biking, and we found that biking controls weight as effectively as brisk walking. We also know that with walking, unlike biking, you can be walking a dog, and you're walking at the pace of the dog, and the dog will walk slowly. So you're not walking as briskly as you could. And you also can slow down when you're walking. The advantage to biking is you can't bike slowly because if you don't pedal fast enough, you'll fall over.
Yeah, I get what you mean about regular activity and discretionary activity. That I can relate to that because I ride my bike to work every day, and no matter how busy I get, I'm going to do that. Where if I'm overly busy or stressed out for something, I oftentimes will skip my other parts of my physical activity routine. So I don't have a parking place, and I'm going to bike here no matter what.
That's great. That's the way to do it. Absolutely.
Great. Orteza, do you have anything to add to that?
Just to add to this, I would like to talk a little bit about walking as a form of physical activity, because this is a very universal and reliable, actually, form of physical activity, and that actually decreases the risk of hypertension in general. And of course, the intensity and duration of walking matters a lot. But in the research, it was shown that 10,000 steps a day for patients who were diagnosed with hypertension actually effectively decreases their blood pressure. And in another study, research within the Nurses' Health Study, those nurses who walked briskly, they had much lower risks of cardiovascular disease. So we can say that brisk walking and bicycling, which are both very intensive forms of physical activity that they could be incorporated in our daily lives, they both can actually contribute to our health by decreasing the risk of hypertension and cardiovascular disease.
Yeah, very important. So, Anne, what do you want to tell us about physical activity in the built environment?
Well, we could continue doing what we've been doing in the United States, which is building sidewalks. And the sidewalks, they're not put on a road diet. They're getting wider and wider. So we've looked at the bicycle environments, knowing that bicycling then does control weight and lowers risk of hypertension. There are different bicycle environments. You can bicycle in the road with the cars, in a bike lane, in the door zone of parallel parked cars, in a painted bike lane beside the curb, on a shared use path, or on what's called a cycle track. And a cycle track is a sidewalk, curb step down, take the parallel parked cars and slide them out, and you've created a protected bike lane. And the research that we did in Montreal suggested that cycle tracks had a 28% lower injury rate compared to biking in the road with the cars. And also there were 2.5 times as many bicyclists in the cycle track compared to biking in the road with the cars. And recently Kate Teschke and her team in Vancouver looked at cycle tracks and found that they have 1/9 the risk of bicycling in the road. We have another article coming out in the American Journal of Public Health in which we looked at the cycle tracks throughout the United States, again with you as one of the authors. And again, we found the safety of cycle tracks. So our emphasis has been on changing the built environment. We do not have a Bill of Rights of Health. We have a transportation Bill of Rights, essentially. We're able to move goods and services, but we're not able to move people in a healthy way. People cannot choose to be healthy if they want to, because their option is to bike, which does control weight and hypertension, but they have to bike in the road with the cars. So we're really focusing on creating cycle tracks, doing as much research as we possibly can do on cycle tracks, so that then people can choose to be healthier if they would like to.
Great. And what about walking? How is that influenced by the built environment?
Well, there are very important qualities of or parameters in the built environment that actually contribute to walking. For example, connectivity of roads and let's say quality of sidewalk and distance for destinations from services. These are very important parameters for people to walk. And based on these parameters, we can distinguish between sprawling suburbs and more dense environments in the urban areas. And what do we exactly mean by sprawling suburb? These areas are car-oriented, basically low density, outward developments and spreading of the city. And they have been shown, found associations, very strong, significant associations with less walking. So if people are living in these areas, they are less likely to walk as much as people living in more dense areas. So this has been recognized and are being addressed by planners and designers. And but I imagine this would be the definition and concept of sprawling suburb would be different from country to country based on the settings they have. For example, if you compare Japan with the U.S., even though it looks very bad, the sprawling suburb in the U.S., in Japan it could be a little different because the overall population and service density is much higher, and therefore people would walk more and would bike and use public transportation, and therefore gain more physical activity compared to the US. However, there is another opposite side in Japan. You have very, very dense areas in Tokyo, let's say in Shibuya or Ginza, that people can't really brisk walk because they might bump into each other. Or there is not enough physical space for bicycles to park or use the streets to ride. So it goes both ways. When we have too dense area, also it prohibits physical activity. Yes, so we have different settings.
Can the physical environment be changed, Dan? Is there a way to do that and encourage people to do more bike riding?
Well, you're the chair of the Department of Nutrition, so you know the complexities of getting people to eat a healthier diet. And one way you might get them to eat a healthier diet is to suggest that they not put a full plate of vegetables on their plate, but instead that they try broccoli, they try Brussels sprouts, they try some green peppers. We're saying the same thing about biking. try it. If you go on a vacation, rent a bicycle. If you have a bicycle in the garage, take it down, pump up the tires, take it to the bike repair shop and get it repaired. Borrow a bike from a friend, making sure that the saddle is high enough. We want people to try biking, because if they try it, they will find that there's a lot of joy associated with it, as in research found in the Netherlands. Also, if they watch their child's soccer game, for example, they could suffer from hypertension being in the stands because they're not engaging in physical activity. Even though their child is engaging in physical activity, they are sedentary. And already 50 to 60% of the time in a person's daily life involves sedentary time. They're not moving. So when they add more time sitting in the soccer bleachers, then they're not engaging in more physical activity. If you ask a child, would you rather bike or would you rather walk? Children always say they would rather bike because it's a toy. And if you are bicycling with a child, you are both then better controlling obesity, you're better controlling diabetes, and certainly the adults are better controlling hypertension, blood pressure. Also, if you look at many of the other sports of which you could play with your children, the adult will play tennis better than the child, the adult will swim better than the child, the adult will play soccer better than the child. So this equalizes the calorie burning amongst the parent and the child. If you go out with a friend, it also is equally fun to go biking. And I will add, you know this too, after you've been a routine bicyclist, you don't know what it was like to once be sore. So we will caution everybody, if you try biking, you might be a little bit sore, but it doesn't last long, and that soreness goes away magically. And when you get on the bike, you just sort of, for some reason, don't even know you're pedaling. But amazingly enough, you're burning more calories pedaling a bicycle than you are even doing brisk walking, simply because you're having to swerve, you're having to control that saddle, you're having to then pick up speed when you're going through the light. There are lots of spurts of energy, and that might be why the calorie burning is so beneficial from bicycling.
And what about walking, Marquez?
I think for walking we can talk about these from two scales. Like one of them in individual scale, more smaller scale, that as we age, our levels of physical activity drop. So if we already have walking or biking in our daily routine, perhaps we have to try to push the boundary a little bit further by increasing the intensity and duration of walking. And if walking is not in our daily routine, perhaps we have to think about how to incorporate it. Maybe if we drive our cars to get to a destination to do something, maybe we can walk to do that. Or if we're living in a sprawling suburb, then we might be able to consider walking not to get to a destination just for the sake of our health. And in the larger scale, I believe that developing countries that are fastly developing, like Nigeria or like Middle Eastern countries, that they are following the footsteps of the US in developing their cities. Perhaps they should look at what has happened to sprawling suburbs in the US and take lessons. For example, what environmental and health consequences these urban environments have. And if they follow these, perhaps they will consider that and develop their own cities differently. And I'm a little bit also concerned about the women's situation in the Islamic countries, in that it's less possible for them to get outdoor physical activity because of the hijab. And then perhaps the governments can consider other interventions, for example, subsidizing their gym membership. Yeah, so it's different settings can have different interventions.
Well, it's really true. It is when I travel around the world to scientific meetings, I see countries growing rapidly, and particularly urban areas growing rapidly. And one of the things that's often missing are parks, places to ride a bicycle, safe places to walk. And once that's been built into the environment, it's much harder to change it than it would be if those considerations were incorporated in the design as cities are growing. So, in fact, my colleagues and I did a review for World Health Organization and Fogarty Institute a few years ago, looking at priorities for controlling non-communicable disease. And one of the top priorities that emerged was in fact, to pay attention to just what you're doing, and including safe places to walk, bike, and play. Without those, it's going to be very hard for people living in relatively dense urban areas to get the activity that they need.
Yes, absolutely.
So, Anne, how do we get more people to advocate for promoting physical activity and a better environment to sustain physical activity? It's nice to say it should be done, but it's often one of the things that sort of falls to the lower priorities when it really should be at that.
It should be at the top. That's the difficulty that we face, and we know that we can go out and propose building cycle tracks and teach people to advocate for building cycle tracks based on the transportation benefits, the sustainability benefits, the lowering mobile source air pollution, the climate change benefits, and even the obesity and lowering hypertension benefits. But those are almost admonishments to people. You are doing something wrong, and we want you to do something better and do something right. And we know even from NIH that they're proposing that those admonishments don't work. 68% of our population is overweight, and they've been admonished since, 1995 now, with the 30 minutes of moderate to vigorous physical activity most days of the week. So we're suggesting using Madison Avenue marketing and going at this a different way. So what would get people to be advocates for changing the built environment? We know that people are social. So instead of just creating a cycle track as a form of transportation, look upon it as a social cycle track. A parent in the Netherlands much prefers to bicycle beside their child if the child is beside them than if the child is in front or behind. Safety concerns, protection concerns. Boyfriend, girlfriend, side by side. Friend with friend, side by side. We enable this side by side conversation and movement when people are seated in a car, when they're in mass transit, when they're walking side by side, when they're in parks side by side. But for some reason, we have followed the lone road warrior bicyclist model and said, oh, well, we'll build a cycle track that is so narrow, only one bicyclist can fit in it, and maybe another bicyclist could pass. But instead, we'd much prefer that the cycle track is wide enough for two bicyclists to bicycle side by side and carry on a conversation, because they then are burning more calories than if they're on that wide sidewalk and they're sitting in the cafe plazas and they're walking slowly as they're doing window shopping. So they're burning calories as they're moving. The second key piece is economic development. You're going to be able to get the developers more interested in this if they know, oh, if I take one parallel parking space and I give that to a bike corral, all of a sudden I have more people biking to the establishment, buying goods, being there in the establishment. They're also burning calories when they're getting there. They're also then lowering hypertension risk.
What about walking?
I think many advocacy groups, they can advocate for just not walking, but also increasing the intensity of walking, and specifically brisk walking, and also bicycling, of course. But in addition to that, I believe providing information and education for developing countries' people, that would make people advocates for changing the built environment for the healthier one. And in community level, if we give power to communities in all over the world to decide how their environments and the neighborhood can change, and if we teach them or give them the information about the health impact assessment, which is very important, so that they assess all the development plans based on the health impact assessment method, I believe that gradually the issue of urban sprawl will be alleviated or prevented in other developing countries. Therefore, I think education and providing information and asking communities to have a health impact assessment in mind when they come across a new development plan or a design or something for the neighborhood would actually make their neighborhoods healthier in the long term.
Great. And what's happening actually worldwide around the issue of biking and promotion of biking as a way to be healthier and have more joy in our lives?
Well, as you know, I had the pleasure of being invited to go to China to lecture there in 4 different cities. And we developed a partnership with individuals in Hangzhou. And we recently completed a journal article that we then submitted to the American Journal of Public Health for consideration. And we found that China is way ahead of other countries in their bicycle environments. We also published an article recently in the Harvard Asia Quarterly looking at the history of bicycle facilities, 1890, 1920, 1949, 1970 to the present, and that was looking at the US, the Netherlands, and China, and comparing those bicycle environments. And we found that China created cycle tracks that were 22 feet wide, and they had 18-foot wide landscaped islands protecting the bicyclists from the cars and the mobile source air pollution. And that they then created a bicycle mass transit system that was so guaranteed in providing speed to the bicyclists that the companies would subsidize the bicycle riders and not the mass transit riders, because they knew the bicyclists would ride more quickly by bicycling than by going by car or by mass transit. We also know that they have lovely bicycle signals in China. They have rental bicycles in China. They have much better bicycle parking inside buildings in China. The other study that we had explored was in developing nations in Africa. We knew that there was an issue. It wasn't hypertension related. It was related to women dying in childbirth, and they had lack of transportation from the rural villages to the clinics. So we looked at taking the soils in a developing nation and putting an emulsifier with it, binding it together, and then rolling and compacting it, and then essentially creating a bicycle highway between the rural villages and the clinics. Because then you lessen the rolling resistance of the bicycle tire, meaning you can use bicycle ambulances, you can use bicycle cargo bikes that are ambulances, you can use even the bicycles that carry water and filter the water as you pedal. And we know that additionally, instead of creating major highways, which means asphalt, sub-base, large construction, having the vehicles, having the repairs of the vehicles, and then also supplying the gas stations, if you create these bicycle highways, they would be used between the pregnant women, rural villages, and the clinics, but also children in high school could get to school. Women could carry their goods to market. So there would be far more benefits. And as you know, because you're a biker, the post between the handlebars and the front tires, there are a lot of bikes that are being sent to Africa, but that post breaks, because if you go over a lot of potholes, then the bicycles are not strong enough. So we could either give them much stronger bicycles without the male bar in the middle, or instead, in developing nations, we could look at creating bicycle highways.
One of the issues, maybe I'll ask you, Morteza, since you've lived in places around the world, is that in many countries, particularly developing countries, it's considered low class to ride a bicycle, and a person with education or a white-collar job would not want to be seen riding a bicycle, which it's a little bit different than here, that in this medical area, definitely hundreds and hundreds of doctors and leaders ride their bikes to work every day. It's almost flipped around a little bit. And I think that is a barrier in many places. Do you have any thoughts about how we address that?
Actually, that's a very important thing that you pointed out. I have noticed in Japan that not many workers or employees of big companies, they ride bikes because it's not explained as a very good means of transportation to come to work. And sometimes insurance companies don't really cover that. They say if you commute by, let's say, train, subway, it's being covered, but if they come by bicycles, it's not going to be covered. That's that. I mean, the image should be changed. Also, in other countries like in the Middle East, it goes beyond the built environment and people's understanding, I believe. For example, it's cultural and religious beliefs that prevents a lot of maybe half of the population from even thinking of bicycles. Bicycling is simply not an option for women because of the religious beliefs and the culture. So just imagine a woman wearing hijab in a very polluted city, because most of them are either hot in the cities in that area or very polluted. So how likely is that those women can get physical activity by walking, just let alone the bicycling, because it's prohibited? So I think each country is in a different stage of providing interventions or thinking of interventions about these. Some countries, like Middle Eastern countries, are still in the stage of recognizing obesity and hypertension as a very serious issue, and they're trying to solve it and address it. So they are recognizing women as a very, very vulnerable population, and therefore they will address these and find interventions later. Or maybe US is far more ahead, so they have had this issue many years ago, and now they have empowered communities to decide how the neighborhoods are going to change. So I believe that all countries have their best in heart to provide healthier environments and have healthy citizens in their countries by making interventions and doing all they can.
Great. Well, that's very helpful. I think we've covered a lot of territory. Is there anything else we should be sure to mention?
We will mention one thing. We're currently working aggressively on bicycle parking issues because unlike the car that didn't have a home because the car was invented after the bicycle, then the car now has a lovely space inside a building. It's even heated in some instances. And the bicycle, as we're finding in our research, has still been an afterthought. There's no permanent place in the time saver standards, in the design codes for buildings, in offices, in schools, and in homes. The Netherlands does have a statute that suggests that you're supposed to have a square footage to accommodate a bicycle. It can be an outside shed or it can be part of your home. The US has nothing similar to that. The closest we have is some office complexes stipulate that you must provide X number of parking spaces for X number of office workers, and that can offset your car parking in a parking garage. Some high-rise residential buildings say you must provide X number of bike parking spaces within the building, but again, that's typically in the basement. And we want to elevate the status of the bicycle, as you say, elevate all of the social status of the bicyclist so that we lower hypertension through engaging in physical activity, but it becomes a social status to lower hypertension.
Well, we look forward to a lot of progress. I've got to run and get my bike to get the next
There you go.
meeting.
I like it. Thank you
Okay.
very much. Thank you.
Thank you very much.